careful about how they draw those targets based on PET images, based on whatever window and level is. There is no standard right now on exactly what constitutes tumor and what window and level you should put to draw that target volume. So in terms of useful advice for imaging, if you can participate in the setup and imaging of the patient for the different modalities, this is often very difficult to do, but if you can, ensure that the patient is in the same position. And if you can't be there, at least understand what the restrictions on the imaging modality are. For example, if they're an MR scanner, do they have a different head position and neck position than if they had because of an MR coil that they had during setup? Before you start the fusion, talk to the physician about the site of interest. What's the location? It's not enough for the physician to give you an MR scan and say, please fuse it to the CT, the treatment planning CT. You need to know, is this a pre-op? Is it a post-op? Is there a surgical defect? What site actually in the head are they interested in? Is it nasopharynx? Are they more interested in the neck region? These help you focus on what regions you need to consider when you're doing the scan, because very frequently patients are not in the same position and the scans are left, fusing two scans manually is left to interpretation of the user. Once that's done, though, you need to communicate your uncertainty in your fusion. And this doesn't need to be quantified in terms of a millimeter or two. You can sit down with the physician and step them through your thought process on how you did fuse the two images and where you think you might be in error and where not. And they can take some of their clinical knowledge and help them draw target volumes based on your communicating the uncertainty. That moves us towards treatment planning. And before the planning begins, it's helpful to ask, is this case appropriate for IMRT? Again, we talked about what cases are useful, but you also always want to discuss, is this a good patient to lie still for 30 minutes or 40 minutes on the treatment table?